On this Lifeflight, a newborn baby struggles for life.
This baby is not treated surgically, 90% chance that the baby's going to die.
A game-winning try leaves a mother fearing for her son.
Okay, stop. Okay.
And every second counts in a high-stakes emergency.
There's been a fatal on this crossing. You take your life in your hands if you're not very careful.
When emergencies strike, time, distance, and the men and women of Lifeflight can be the difference between life and death. This is Lifeflight. The fixed wing specialises in the care of fragile newborn babies who start life needing immediate medical help. Today, crewman Phil Harris is travelling to Wellington Hospital to pick up their latest charge.
We've been tasked now with the job of going from Wellington to Auckland with a, as I understand, a fairly sick cardiac baby that needs some sort of intervention. So we'll fly from Wellington Airport up to Auckland.
Baby Oakley has been born with a condition called transposition of the great arteries. Early scans revealed the pipes that take blood to and from the heart are reversed, preventing oxygenated blood from moving around Oakley's body.
I get them out as soon as they can, so...
New dad Aaron has been on an emotional roller coaster ever since.
1 minute you're so happy to be getting a scan and looking at the baby on the scan, and then the next thing they're telling you, oh, you've got heart problems, you're going to have to go Auckland Hospital, you know. It's like something completely out of the blue. You just stuns you, absolutely shocked.
What she's just doing now is just doing a pre-flight or a pre-use check of the incubator.
Make sure we got everything we might need.
Phil and flight nurse Kylie Kerrison will rely on this incubator and their skill to keep Oakley alive, thousands of feet in the air.
You are on your own. You never know what can pop up. Hi.
Getting some photo device.
Oh, yeah, all good. You're not saying bye, you're saying see you soon.
Newborn Oakley is facing a series of time-critical operations at Auckland Hospital to switch the arteries attached to his heart.
Still very edgy. You know, he's still not out of the clear yet, so... He's not out of the clear until he's up there, really. So.
Right, it's happy.
You happy?
Mm-hmm.
So we're good to go?
Good to go.
Mum, Kerry, is still recovering from the long birth.
Very, very sad day. Quite sad.
En route to the Lifeflight base, Kerry gets the first chance to really look at her son. Kerry will travel to Auckland with Oakley, but Aaron must stay behind to look after their firstborn child.
Just slide.
Feel good at the back there, guys? Roger, lifting off this time to the south by my point, 1,500 below, capture.
Meanwhile, the Lifeflight team are on their way to a high-impact crash where every second counts.
So what do you reckon, about 15 minutes to there?
Yeah, probably from here, yeah.
Pilot Harry Stevenson, crewman Logan Taylor and intensive care paramedic Dave Chittenden receive more details.
It's a car versus train. Sounds like some quite serious injuries, and so that'll involve a landing on most likely on State Highway 1. Fire and police have got it all sealed off for us, so we're just booking it as fast as we can get there.
Thank you, Program 1. All require RSI, sorry. Male looks to be about 90 kilos. I'm there, fine.
Airline Wellington received a request for RSI.
So we're concerned that the patient suffered a traumatic brain injury, and as such we'll need to look after the patient's airway and ventilation to prevent any secondary brain injury.
Paraparam traffic capital 01 located State Highway 1, abeam Tihoro and descending to land.
There's a car down there next to the track on the side.
Yeah, got you. Thanks, mate.
State Highway 1 has been closed to traffic and turned into a landing pad to get the team on the ground as quickly as possible.
Alrighty, cleared out there, guys.
Okay, let's just do it from the top. What are we looking up here? Is it a depressed skull or?
He's a fracture in here.
Thanks. Yep, okay.
Father of four, Adam, drove over an uncontrolled crossing and has been swiped by the freight train. Local Tim knows the dangers of this intersection.
Very easy for this crossing because you're coming along and you're actually concentrating on the main road. You're not actually thinking about the railway.
Here's some more tourniquets here.
Adam has a hole in the side of his head and blood is coming out of his ear, but his compromised breathing is Dave's first concern.
Keep up with that oxygenation and jaw thrust, Sarah, once that's on. Yeah, I think we've got a bit of an airway issue.
It's seizing.
Is he having a seizure, is he, or is it just a pain? An IM dose.
Shards of bone from Adam's skull could be pressing into his brain.
Yeah, he is. Have you got some? Let's just give...
There's another one here, but I've had a crack at that one already.
At the rail crossing, train crash victim Adam is seizing, but his poor veins mean the team can't easily administer medicine to stop the seizure.
I got some patients actually, have a look.
It was before I was
Push too hard and suddenly...
Yeah, we'll put in an external jugular if we have to.
Chief Fire Officer Ian King has seen this all before.
I've been to 3 on this crossing, so it's, yeah, this is, there's been a fatal on this crossing. There was another one here last year. You take your life in your hands if you're not very careful.
All right, that was 15 and 15, yeah, so we've got a milligram and a half on. This one have a recess of his chest now, that sort of.
The seizure has ended, but Dave needs to insert a tube down Adam's throat to get control of his breathing, using a procedure called rapid sequence induction.
So we definitely are going to RSI, guys. We just need to get some better access. And I just want to do a full assessment of this from top to bottom. Has he got a fractured jaw, do you think?
I don't know.
Oh, he does have a fractured jaw.
Yeah, he does have a fractured jaw. It's really...
We're going to start moving shortly.
If Dave can't get the tube past Adam's damaged jaw, the status 1 patient may stop breathing mid-flight. Lifeflight's air ambulance is above the Tasman Sea on a mercy dash to help save Baby Oakley.
The pilots have just informed me that we've got direct Auckland with priority, so we're now going to have an ETA of 15:48, they've informed me.
Patient 7's ETA now 15:48 hours.
That's the one.
Cool, no worries at all.
Thank you, bye.
Captain Dion McMillan and First Officer Pete McNee are at the controls as Kylie and Registrar Joji Vajesi monitor Oakley for the smallest change in his oxygen levels.
That's a saline, eh? Saline, 0.9.
Yep.
Yes.
Yep.
Sorry about that.
You're connecting it to the UVC, Kylie.
UVC, yep. That's all I got.
Yeah.
The team are using a fetal blood vessel to circulate oxygenated blood around newborn Oakley's body. This duct would usually close after birth, and they are having to infuse a drug through a vein in the belly button to keep it open.
So that duct closes on us in flight. That would be worst case. We don't want that to happen because we need to get this baby up to Auckland ASAP so they can get baby off to surgery.
Oh.
What?
That's interesting, 158. I hope he hasn't bled.
Ah.
Oakley's saturation levels are dropping, which may mean the duct is closing.
Quite a
Let's
big
get to
drop,
Auckland. It's a huge drop. Yeah, CO2's gone up to 50.
50.
A further increase in CO2 levels could mean that Baby Oakley is not absorbing enough oxygen.
See, when you did that, our pip just jumped up. Maybe that's what happened before. Are we starting to...
I think he's starting to wake up.
Yeah, yeah.
Just give him
Do you want some more pink?
Yeah.
Yeah, there you go. He's starting to move his hands now that you're playing with him.
I'll just let Mum know what you're doing because she's...
Breeding?
Yeah, it might be.
Just say baby's waking up, so we're just playing him off to sleep.
It's a respirator.
Because he's a big baby, he knows he shouldn't have a tube down his throat. He was trying to fight the ventilation, in which case our sats and things were starting to drop, our oxygen saturation. So we just gave him a little bit to send him back off to sleep. Sats are 43, 44, 45. Your CO2's reading 38.
Oh, good. Good. That's better.
That's better.
Going down through the cloud.
With a tiny baby attached to respiratory equipment in the back, the pilots must use timing and skill, but even the smoothest landing can create problems.
Priya's saying 95.
A new spike in the readings has Kylie worried.
You call the numbers. If your stats get below 95, let me know. And if he keeps going down below 90, I need you to let me know. Let me know if his heart rate starts to drop as well.
Back at the train wreck, Dave is attempting to insert an airway past Adam's broken jaw.
And tube, please. Thank you. Just put that introducer down further. Right down, right down. Thank you. Scratch your jaws, give me grief. So much blood in this airway. Take that introducer out. I need that size 7 tube. Okay.
Dave carefully feeds the breathing tube down Adam's throat into his lungs, and the team start breathing for him.
He's got a fractured jaw, which is making laryngoscopy really difficult. It's the toughest tube I've had in a long time. On the count of 3, 1, 2, 3. Great.
Kilo 1020, and we're transmission currently with 5 on board requesting priority joining for the hospital.
We're coming to you from the Kapiti Coast with a middle-aged male, single occupant of a car versus train, high mechanism, significant cabin intrusion. He's been dragged from the car unconscious. Predominant injuries are a boggy mass and suspected skull fractures to his left temporal region.
That's a good rate and volume, Logan. We've induced a coma and intubated the patient. Now we've got him maintained ongoing ventilation. He's sedated and paralysed. Basically, we've commenced intensive care level treatments, and we're going to carry that on at the emergency department.
Capital 01, landing the hospital.
The Lifeflight team have made an hour-long ambulance journey in 15 minutes, and that speed may be the difference between life and death. The next hour will determine Adam's chances of survival, but the Westpac rescue chopper has been called away on a new mission. A rugby tackle has gone terribly wrong, and a young boy's future is on the line.
Need priority to vacate or?
Yes, please.
At the Lifeflight hangar, the team are quickly in the air and responding to a new time-critical mission.
Got it as a 30 Bravo 1 trauma possible dangerous area. What's the nature of the incident?
12-year-old male, rugby injury, neck.
Comms Air 1 Wellington, roger, all copy, thanks very much. Copy that, Nigel?
Affirmative. Capital 01, we're clear, Auckland level.
Pilot Dean Herrick, crewman Colin Larson and intensive care paramedic Nigel Stevens are 35 minutes flight time from the accident site.
Obviously with an injury such as this, we want to basically stabilise the neck and head and rule out any other possible injuries.
The young rugby player is over 140 kilometres away in a remote town, but strong turbulence is buffeting the Westpac rescue chopper.
Reasonably windy across the ranges at the moment and sneak down through the valley.
Yeah, rock and roll.
This is pretty rough for a spinal.
Ain't much alternatives.
Violent movements caused by the gusting wind could worsen any spinal injury. Dean and the crew have to be prepared to pull the pin on the rescue.
Our destination should be just on the other side of that pine tree plantation.
Yeah.
Goalposts, light standards. I don't see any. I've got a power pole just standing there. Oh!
Go ahead, vehicle calling.
Don't see which way the wires are running.
Parents have cordoned off a landing site, but suddenly someone sprints out into the danger area.
Don't run out onto the field. Got a couple of cones just on your left-hand side.
Yeah.
And just watch this guy coming around by the tail, Dean. I'll just a bit worried about the way he's walking up towards us. I think he was only going for the cone, but...
Are you comfortable on the board?
Oh, my head's sore.
Rugby player Zach was scoring a last-minute try when an opposition player slid in for a tackle and kneed him in the head. Mum Sandy was horrified when she realised it was her son writhing in pain.
Worrying, to say the least. You see your son there on the ground?
In Auckland, Baby Oakley's life is at risk. The newborn's recorded vital signs have altered after landing, bringing fears he is arresting.
Oh, that's wrong though.
Yeah, that's what I mean. Here we go.
It's been a tense flight, but for Mum Kerry, the worry is not over yet.
It's been a very full-on couple of days for us. Wondering what will happen next and how we deal with it. Yeah, because it's all very real now.
Okay, go to just slide. It's enough.
Lights and sirens. What was the blood pressure? That's better. 55, 30, 38. Yeah, like that high pressure.
This baby is not treated surgically. 90% chance that the baby's going to die. But you know, with surgery, the prognosis is really good. I think the mortality is very, very little. I think it's more less than 4% or so.
Auckland traffic, it's blocked. Look at it.
The team negotiate the packed streets and finally arrive at hospital. In the Wellington Emergency Department, doctors are working to identify all the injuries father of four Adam received when his car was hit by a freight train. Registrar Natasha McKay's initial assessment is hopeful.
At the moment it looks like it's just an isolated head injury, but we're obviously with that mechanism of injury quite suspicious that there could be lots of other things going on, but obviously quite a nasty head injury which concerns us quite a lot.
Close friend Ishmael has rushed to hospital where concerned family and friends are gathering.
It is a very difficult time for the family. And for Adam's friends. Adam is not an ordinary person in the community. He's a leader, he's a man of standing, but I think our major concern now is for the family. He got kids that need him, and he needs them. So.
Scans reveal Adam has fragments of bone embedded 7 millimetres into brain tissue. Intensive care specialist Paul Young inspects the injuries.
He's had a very severe injury to his brain, and in fact, often we see in the setting of a severe brain injury that the scan doesn't necessarily show all the damage to the brain.
The surgery team begins by attempting to reduce the pressure in Adam's skull, which is threatening to create permanent brain damage.
Is that a little more comfortable?
Yeah.
Great.
Back in the Wairarapa, 12-year-old Zach has worrying pain in his neck after an opposition player's tackle ended badly.
Yeah, I went to score the try and got kneed in the head.
You saw anywhere else go in your body?
No.
No? Okay, but just the neck on the side.
Yeah.
Just look at me for a minute. Okay, close your eyes.
The assessment is difficult to complete with Zach strapped into the stretcher.
I don't really want to unpackage him completely to reassess him, and if there is an injury, risking worsening that injury, and it's something I don't want to do. If we can load him, that'd be great, guys.
Okay, 1, 2, 3.
Okay, how are you feeling?
All right.
You been in a helicopter before?
No.
Okay, it gets quite noisy.
Yeah.
And there's a lot of vibration, okay? But you're in good hands.
Yeah.
Look, your dad's going to sit right at your head. Yeah. How's that?
Transporting now through to Masterton Hospital.
I was young Zach here. We want to basically rule out any serious injury. He is muscular at this stage. It's a lateral neck injury with no neurological or sensory deficit. And he was not knocked unconscious either. However, he did score the try. Yeah, potentially a winning try at that.
X-rays and CT scans showed no damage, and 4 days later doctors gave Zach the all clear to strap on his rugby boots again.
We can just do that then.
Kerry and her newborn son are back in Wellington Hospital after surgery successfully rerouted the tubes that feed blood through baby Oakley's heart, and now he is breathing for himself.
Both me and my partner are just quite concerned about just getting Oakley on the right sort of type of track and sort of, you know, making him a normal little baby, the best that we can. So it's hard on everybody, but we're just trying the best and trying to get all the advice that we can to just get him back on the track.
Oakley left hospital 10 weeks later. He is closely monitored to ensure his heart develops properly and is showing great progress.
It's okay, Steve.
Following his operation, Adam is awake, and with wife Kahadra by his side, he begins his journey to recovery.
I've been through a very difficult time, recovering and suffering and all sort of things, much better than before.
The Lifeflight team's quick response time helped to reduce the damage from Adam's brain injury, increasing his chances of leading a normal life again.
From the bottom of my heart, I want to say thank you so much. The helicopter is the essence of life, so God bless them. They done an amazing job.